All right. If you guys want, I can put the review questions up here. Do you guys want me to do
That
that?
would be great. Trying to access them to my phone. My phone is slow.
Yeah, it's easier if you don't have to use your phone. All right, so Katrina, answer that first one. What are some examples of an intentional tort pertaining to surgical patient care?
Assault, battery, and false imprisonment.
Yep. Yeah, so those are some examples. Defamation, emotional distress, invasion of privacy. Those are some other ones. Good job. Nicole, what legal doctrine would most likely apply in the case of a wrong site surgery or retained foreign body? Remember that thing you guys were talking about when we came in? And it kind of sounded, I don't know what the question was in MindTap about, but somebody brought it up.
Negligence?
Corporate negligence.
What were you guys talking about? Yes. Right. Right, and it's locator, because the thing speaks for itself. If you leave something in someone, it's pretty hard to say you didn't do it, right? I'm sorry? What were you said?
So the rest.
Yeah. Yeah.
Those are doctrines as well.
That's what I was wondering.
It's underneath.
Right.
Yeah, it's underneath, so.
All the other ones say doctrine of.
Yeah.
Okay.
All right, Megan, what legal term, the phrase, the phrase departure from the standard of care best describes what legal term? Yes.
What is negligence?
Yep. Kagan, what legal term best describes as professional misconduct that results in harm to another?
Malpractice?
Yes. All right. Danielle. What is the term that describes a method of pretrial discovery in which a surgical team member might answer questions under oath? Pretrial discovery. What is that called? Anybody?
What did you say? Pre-trial what?
Pretrial discovery. So basically they're getting with you.
Deposition?
Yes. They're going to get with you before they actually go to trial.
Deposition?
Take your deposition.
Deposition.
Yes. Colleen, what torts would be classified as unintentional?
Patient misidentification, performing an incorrect procedure, foreign bodies left in patients secondary to incorrect sponge, sharps, and instrument cam, patient burns, falls or position errors resulting in patient injury. Improper handling, identification, or loss of specimens, incorrect drugs or incorrect administration, harm secondary to use of defective equipment, instrument, loss of or damage to patient's property, harm secondary to a major break in sterile technique, ceding authority or accepting functions, violation of hospital policy, and abandonment of patient.
All right, Makila, which type of consent applies when emergency circumstances exist, when reasonable providers believe that a patient would agree to treatment even if no form was signed or verbal permission given?
Implied consent?
Yes, implied. Kristen, a special consent form would be required for what situations during a hospital admission?
I don't know.
Surgical intervention.
Right. So informed consent or just a general consent is just basically for general things. But anytime anything out of the ordinary has to be done to you, so surgery, anesthesia, what else I wrote down? Transfusions, chemotherapy,
Yeah.
then they have you sign a surgical or special consent.
So that's the answer?
Yeah, so yes.
Surgical? Okay.
All right, Dan. Which member of the surgical team is ultimately responsible for obtaining a written informed surgical consent from a patient?
That's the surgeon himself.
Yep.
Or himself or herself.
Yes. So a lot of times, if the patient's on the floor at the hospital, they're waiting for the surgeon to sign a consent before they can even bring the patient down to the holding area. Because it doesn't do any good to bring the patient from their room if they don't have a consent signed. So those are things that are looked at first before anything else.
Where's the paperwork?
Yep, where's the paperwork?
Yeah, I was thinking surgery was that. Yeah,
Implied consent?
Shayna, what are components of the surgical patient's medical record?
That is somewhere in here. Give me a second.
Page 34. Can you see all right? You guys, can you see okay?
Yeah.
Okay. I know the light on that isn't very good.
It would be identification of the patient or of the physician, nurses, and other healthcare providers involved in the patient's care. For example, operating room record will name each member of the surgical team, patient's medical history and physical examination, diagnosis, treatment plan details and results, medication record, physical findings during the hospital stay, discharge condition, and possible follow-up treatment plans.
Good job. Sorry, I'm trying to get back to what we were on. I was trying to make this thing brighter, but all I did was get rid of it. There we go. Okay. In 2004, which agency created the Do Not Use abbreviation list?
The Joint Commission.
Yes. Yes, sorry, I forgot to say Rachel. Ron, what's the name of the type of report sent to risk management in an effort to decrease the chance of harm to patients or staff or damage to hospital property?
Incident report.
Yes. Incident reports, sentinel events, so those types of things. All right, Katrina, back to you. What surgical patients would be legally authorized to sign an informed surgical consent based on medical practice acts and state law? What do you guys think? So what about your child?
Guardian?
Yeah, so a legal guardian, somebody that's of legal age, or an emancipated
Minor?
minor. Yes. Okay.
Don't certain circumstances, a minor has a say over certain medical procedures.
I'm not sure. I mean, I'm sure that, like, if somebody was mature enough to make a decision.
Teen parents don't they have a say over their health that way? Maybe not like what shots they get, but like
This is a patient.
If a surgeon felt that something was medically necessary and it was a teenager that was saying, I don't want that done, they could probably go to court, and then a judge would determine if they had, I mean, I would think if they were mature enough and understood what could happen if they didn't have the procedure, that a judge would probably uphold their decision. All right, Nicole, back to you. What document pertains to a patient's wishes about medical treatment and self-determination in the event of incapacitation or inability to communicate?
Page 35.
Something that everybody should think about doing, really. Yes, an advance directive. So if you guys don't know what that is, basically it's a directive. If something were to happen to you, and you need to do it now while you're healthy, because when things happen and you're unconscious and unable to answer questions like, what would you want? Would you want to be kept on life support? Just different questions like that. If you fill out an advance directive, it will tell the medical facility how to treat you. You know, would you want to be kept on life support in a nursing home if that were the case? So if you have one of those filled out, you know, you could keep it in your wallet. And if you guys ever need anything like that, you can go to any hospital and they'll provide you with one to fill out. You can more than likely find one online to fill out and keep with you. So that way people know what to do if you're ever involved in an accident and you want to speak for yourself. All right, Megan, what term best describes the process of keeping thorough, accurate, and legal record of patients' medical care?
Is it medical record or documentation?
Yes.
What is it?
Medical records or documentation.
Documentation.
Yeah. Tegan, which documents carry the force of state or national legal enforcement? Let me look that up.
Legislature.
I put HIPAA, but I'm trying to find where I found it though.
39.
Yeah, it's on page 39. I know it said that, but I can't find exactly where it says that. It's the first federal act to establish privacy standards to protect patients' medical records and other health-related information.
Wow.
But that question's kind of,
It
Yeah,
is. It is kind of vague. Yeah, it's like
Yeah.
I'm looking at it thinking, huh? What?
like, yeah, it could have many different answers.
It could.
That is the answer.
That is, yeah.
I'm gonna miss that.
But I'm using the book on this. So I have no idea.
Okay. Anyway, hopefully when you see it on the test, it'll make more sense. All right. Back to you, Danielle. The American Hospital Association replaces its Patients' Bill of Rights with what?
Patient care partnership.
Yes, Patient Care Partnership. Colleen, you always get the long ones. The
After
broad.
that first short presentation.
Yeah. See what happens? The broad objectives of HIPAA include what?
Ensure health insurance portability even in the face of pre-existing medical conditions. Guarantee the privacy of health information of all patients. And decrease the incidences of fraud and abuse in healthcare community.
Yep.
Is it the other 6 too?
It's okay.
No, just those 3.
I think as long as you guys know what HIPAA is all about, and you have a good understanding of HIPAA,
Mhm.
it's really important that we follow it. All right, Makila, what term describes a civil wrong that may be intentional or unintentional?
Tort?
Yes.
Or tort?
Kristen, what are the most common types of patient care errors committed by operating room personnel, including negligence and malpractice, and are categorized as?
Yeah, I don't know. I haven't found it.
I think it's this one.
Unintentional torts?
Yep.
Is that it?
Yep, those are the most common. Because it's stuff that's, they didn't mean to harm the patient. All right, Dan, in a common adage, what is the best medicine in healthcare? An apple a day keeps the doctor away.
I would.
Is that the answer?
No.
No.
Prevention.
I was going to say something like prevention of the isue to begin with.
Yes, that's it, prevention.
Okay, prevention, okay.
Yeah.
So, avoidance.
Shana, according to the Joint Commission definition regarding consent to a surgical intervention, which party has autonomy?
I remember seeing that phrase somewhere.
Who has to give consent?
The guardian?
The patient.
Parents? The patient?
Yeah.
Okay.
Patient or guardian.
Yeah. And it's on page 31.
You said 31.
Rachel, what term describes the system of principles that become standards of conduct for professionals?
I no idea. Professional ethics.
Yes, ethics.
Oh, I was close.
What does it say? Ethics?
Professional ethics.
Oh, professional?
Yeah, professional ethics or ethics. So what term, Ron, describes the principles such as benevolence, trustworthiness, and honesty for the care and well-being of others in society?
Is that moral principles?
Yes. So your morals. So, Katrina, this is a good question. What are considered examples of potential ethical dilemmas? What would be an ethical dilemma for you, Katrina? What would be difficult for you to deal with the patient in the OR if you knew something about them or something that was going on? If they had a sex change, if they were going to have a sex change operation, if they were maybe going to have an abortion.
Assisted suicide.
Yep, assisted suicide.
Well, the 5-year-old son has a religious belief.
Oh, yeah. Life-saving procedures versus religious beliefs.
Yeah. So there's kind of a long list of different things, and it's kind of personal. It's like what might bother you, I might be fine with. You know, those are things that we have to think about. Like this crazy guy that killed all those people in Las Vegas. If he wouldn't have died and he got injured, the people in the OR would have had to treat him, and they would have had to treat him like they would anybody else, even though you knew that person was responsible for killing many people.
That would be hard.
It's
Yeah, that's gonna-
those are the types of things that you might have to deal with.
So you can't ever have that.
Not usually. No.
Was that on all of these?
What page are you on?
Page 40.
40.
Yeah. Hold it, a whole list of them.
Yeah. Yep. Yeah. So, I don't know. I meant to look that up. Let's look it up. Anybody know?
What?
Good Samaritan law.
that if
Good
you-
Samaritan law
should
is-
stop
You help somebody?
Yeah, if you're able.
Okay.
And if you
Oh.
don't, it's, what is it? If you don't, it's
Negligence?
Negligence.
Okay.
If you know how to,
So
If you
see
can
somebody
and you
down
know
and
how, you
don't
should.
give them CPR even though you're
You should,
certified
yeah.
to, you can get in trouble for negligence.
Say you're watching
That's.
and you're certified for CPR, and you see a car wreck and this lady's like laying on the concrete in front of you dying, and you just walk by her.
But then the family can sue you if something happens and the family doesn't make
It's
it.
it's
then the
questionable.
You get sued if you don't
it's
help.
questionable.
Yeah.
Yeah,
But if they don't know that.
that's where the term deliberate indifference comes in, where you have to actually be able to, that's hard to prove.
So don't go out.
Sometimes
and
Deliberate
too,
sue.
like
indifference.
if you don't have like that plastic thing like this right here, if you don't have that and you perform CPR on somebody mouth to mouth, then that person can sue you too because, you know, you put your
I just got
mouth on them.
certified a couple months ago, and they said don't even do.
Yeah.
mouth to
Yeah,
mouth. Don't even
They
do
don't do that
No.
anymore.
Which is good. I mean, they're
Yeah.
saying chest compressions.
Yeah, aren't they saying chest compressions only?
Yeah.
They totally taken out the breaths?
Mm-hmm.
Wow.
Yeah. So.
You wanna hear something
Yeah.
crazy? They're in China or, you know, over there where they're really crazy populated. Touching somebody, if you get hurt, you assume liability right away. And if that person dies, like you see it all the time, if you go on YouTube and you watch like Asian, you know, like pedestrians get hit, you'll see people walking just right by them, just like,
Can't even touch
not
it.
gonna touch them. Yeah, it's sad.
Because they're suing them if they touch them.
Yeah, well, yeah, the parent, you know, whomever, even if they save their life, they'll sue them, or, you know, like I've even seen like videos where little kids got hit by a car and their people are just walking by, just like, don't touch the kid because they get sued.
Wow.
Yeah, people are really,
They're so sue happy.
yeah, people are very sue happy.
Like you have to do the dash cam and everything, because
Oh, yeah.
people like running into your car and then like falling down. And
Yeah, oh, yeah.
It's crazy.
Yeah, there's a lot of crazy stuff. I did a procedure with a surgeon who basically saved someone's life. He had gotten his throat cut, and he saved his life, but the person was not able to speak anymore, so he wanted to sue the surgeon. And the surgeon saved his life, so I don't know what came of it.
Wasn't there just a thing, like, if you get training in the in the military, there was a lady who was the military's form of EMT. Oh, yeah, there we go. And she became a civilian, and she came up on a car accident. She performed the services that she knows how to do, but she got into major trouble because she wasn't certified in civilian.
Jeez, yeah, it's crazy. Yeah, it's crazy. You sometimes have to question, you know, when is a good time to help? I mean, I think our instincts are to help. So I think I'm going to help somebody. And I guess if they want to sue me for helping them, well.
Give them a false name.
Yeah.
Right. It's a big loving.
All right, Nicole, the legal term that identifies the knowledge and skills required for a profession and describes a healthcare provider's core accountability based on education, experience, and credentialing. Yeah, and it's important that you guys understand and know what your scope of practice is, because you could be asked to do something that's not within your scope. If you do it and something happens, then basically you're liable.
That's what I wanted to ask. In the book, it says if the surgeon feels that you're competent enough to perform something and they direct you.
I think you have to
say
use
that's
your
beyond my
conscience.
scope of practice? But if it's the surgeon's, you know, demand or whatnot.
They can't necessarily demand you. They might say, how about you close this for me? And you know it's not in your scope of practice. You can tell them I don't feel comfortable doing that.
But even if you were to perform that and say something happened, you could get in trouble.
Well,
Even if the surgeon told you.
Yes.
and that kind of goes back to the captain of the ship.
Yeah.
Because, I mean, probably in court, it would go back to the surgeon because they were there and they were the responsible person. So if you did something, I mean, it's still kind of, you
It
know.
also depends on what you inform them. Because I was talking to my wife about that last night, and she's running into situations like that. She says, I just tell the doctor, that's outside of my scope of practice. I would if I could, but legally I can't.
Right. Well, just in the book, it says it's kind of up to the institution and the surgeon and the policy.
Right. So when you sign a contract to work somewhere, as far as you're going to be given your scope of practice.
So if you sign a contract, then
You know what your scope, and yeah, I mean, they really expect you to know what your scope of practice is for surgical technology.
it just talking about like if there was like an emergency situation, it was like, hey, I need you to do this, you know.
Yeah. And you'll be surprised at what people will come back and sue for. Just remember, people sue for anything. So you can save their life and you think I should have just let them die, because they can be bad like that. But that's what we do. We save lives. So, all right. What is a form of individual professional credentialing that protects the public from unqualified healthcare providers?
Accreditation?
Yes, Megan.
Oh, sorry.
That's okay.
Thank you.
No, go ahead.
Credentialing, what was it?
Yeah, so what is a form of professional credentialing that protects the public from unqualified healthcare providers?
I just put credentialing, but did you say something else?
Well, that's why we become certified, why nurses are registered, doctors have a license to practice. So all those, okay?
Like your registration?
Yeah.
For credentialing?
Okay.
Credentialing, yeah, our credentials tell them that we're qualified to provide our care, the care that we provide. Verification that educational programs meet minimum accreditation standard is done by what? We're talking about surgical technology. Yes. Which is what?
Certification.
I know the last part is hours of education.
Yep, education programs. So, man, I thought it was right here.
Commission on Accreditation of Allied Health Education.
Yes, commission.
It's on page 20.
On page 24? So that's just for us, page 24.
I was at 42, I was dyslexic.
It's not even in chapter 2.
Oh, well, it's there,
The
but it just
definition's on
doesn't,
chapter 24, or page 24.
Doesn't spell it out.
it doesn't spell it out. Yeah, just KHEP, and I should know KHEP because I have to deal with them all the time.
That's the answer there. It's
Yeah,
Okay,
for us, it's KHEP. All right, Danielle, graduates of KHEP or ABHES programs are eligible to sit for the CST or CSFA examination administered by who? So it's National Board of Surgical Technology and Surgical Assisting. So S, Surgical Technology, SA is Surgical Assistant.
Okay, wait. what
So
is
yes, you're right.
it? Oh.
is that same one, the NB, NBSTSA?
Yes.
24. 42.
42.
Colleen, the best assurance of safe and individual professional behavior by the CST or CSFA is a well-developed, unyielding, what makes us have good professional behavior?
Would it be surgical conscience?
Yes. Our conscience. And that's on page 41. All right, Makila, what legal doctrine would be applicable in a case involving failure by the RN and CST to do a proper surgical count, resulting in retention of a foreign object and the surgeon being found not liable?
Is that the same thing as like the MindTap thing?
I'm not sure what MindTap had.
Is that
Well, the one that we were talking about?
No, it's not a report. It's a legal doctrine.
Doctrine of peaceful life.
I was gonna say maybe
Is
it's
it the respondents?
No, it is, where am I? Doctrine of a borrowed servant.
Oh,
Page 29.
Okay.
Yeah, because the surgeon's not responsible because it was your responsibility and the nurse's responsibility to count.
Page 29.
Yes,
because the surgeon doesn't have to perform the count.
they're not responsible for it.
Right.
Right. All right. Kristen, what legal doctrine would be most applicable in a case involving injury to a patient as a result of a hospital employee lack of proper training or credentialing?
Is that the doctrine of corporate magic?
Negligence.
Yeah.
Yes. Yeah, it is. Yeah, the hospital is basically responsible to make sure that we are credentialed and properly trained to perform, whatever duties. Dan, what type of legal action is most likely in cases involving tort law and operating room personnel? What legal action is it?
I'm talking like something like assault or battery or claiming battery because
No. What kind of a lawsuit are they in? Yeah. So a civil lawsuit.
oh okay.
Page is 29.
Yeah, 29. All right, Sheena, if a patient suffered a burn as a result of improper application of the ESU, the grounding pad, the individual team member responsible may be found guilty in a lawsuit of what?
Would it be negligence?
Yes.
Okay, negligence.
Yeah. Rachel, specimen loss, mislabeling, and improper preparation are examples of what?
Negligence?
Yes, negligence again. People have accidentally thrown out specimens, and that means that the patient might have to come back and have a second surgery because they threw that specimen out. All right. Ron,
Yeah.
what term meets the following definition? A voluntary and informed act in which one party gives permission to another party to touch.
Is that consent?
Yes,
Or
it is. Yep, it's consent. So people in the hospital can't touch you without asking you first. Touch me. All right, Katrina, back to you. What form of consent is defined by the Joint Commission as an agreement or permission accompanied by full notice about what is being consented to? Anybody know? Informed. Basically, they're telling them exactly what they're going to do. So when you go to the doctor's office, or really anybody's treating you, they should be telling you everything they're doing to you before they do it. I'm going to give you a shot. They'll lie and say, it's not going to hurt. She tell them, you're lying. It's going to hurt.
Do you not like needles or what?
I hate shots, but I try to avoid them if I can. All right, Nicole. Surgical team members who fail to monitor and protect a medicated patient from falling could be charged with what?
Abandonment?
Yeah, abandonment. Yeah. So we're responsible for staying with the patient because they have no idea what's going on. They're under the influence of some kind of drugs, so. Which part of the patient's medical record documentation would contain pre-op and post-op diagnosis, positioning, skin prep, start and stop times, counts, and dressings?
Is it intraoperative?
Yes. And they put everything on there. They put everybody who's in the room, their names. So if you guys ever have surgery, check it out. Intra-op. Yeah, because it's dealing with intra-op stuff.
Page 34.
Again, what department? For what department are identification and reporting of unsafe conditions and hazards most critical?
Risk management.
Yes. Back to you, Danielle. What was identified in the late 1990s as causing more deaths in the United States than car accidents, AIDS, and breast cancer combined? Crazy. On page 36.
Basically. Medication errors.
Yep. Medical errors.
Medical or medication?
Medical.
Medical
Yep.
errors.
Which is, that's pretty bad.
Yeah.
All right, Colleen, the long one. The answer's not long, just the question. What is the name of the organization who focuses on patient and worker safety and is a unique coalition of surgeons, anesthesiologists, operating room and peri-anesthesia nurses, CRNAs, surgical physician assists, and surgical technologists? Hmm? No. Mm-mm. It's on page 36.
Is it OSHA?
Yes.
No, or CS.
No, it's the CSTS, the Commission and Council on Surgical and Perioperative Safety.
CSPS?
Yes.
Oh, that's.
Council on Surgical and Perioperative Safety.
Yeah.
What?
Safety.
Safety?
Makita, what is establishing a neutral zone designed to do?
Reduce risk.
Mainly what kind of risks? Yeah, it's sharps. Sharp injuries, yes.
You were doing scuffle yesterday. That was not.
On page 37. Yeah, and there in that box, 2-2, it talks about implementing of the neutral zone and why it's important. Most places you're going to go, they don't do that. It's not that, it's too bad, but.
Do some surgeons get mad if you want to use like a basin or?
Probably look at you like you're crazy.
What are you doing?
Yeah.
I did see a surgeon, I think in Durango, that uses a basin, and I was really impressed. Yeah, but that's only one out of all the ones that I've seen. And so
ensure that no person-to-person passing of sharps occur, and reduction of percutaneous injuries and blood exposures. Okay.
Kristen, which governmental agency has authority as outlined in the Safe Medical Device Act?
FDA?
Yes. They regulate medical devices. And last question, the first scrub surgical tech.
38.
The first scrub surgical technologist performs intraoperative tasks under the board delegatory authority of
For operative tasks, I would say the surgeon.
Yep.
Surgeon himself.
What page is that?
I didn't find the page number on that one. Let's see. I know I seen it.
I think so.
So do you guys have questions on anything?
On page 41.
41, okay, thank you.
Still don't have any, mind tap this weekend.
No mind tap, no.
Just study.
Yeah, just study.
I was trying to do chapter 6 mind tap last weekend. I didn't know we didn't have anything to do.
Oh, yeah, no mind tap due this weekend. Yeah. Just study for the test, which is on Monday, and then your final on Wednesday.
And just basically review all your study guides and stuff like that. Reviews.
Can we print out our old tests? Like,
I don't know that you can. I think once they're closed, you can't. You could try, I guess.
Can we print out any other reviews that we might be missing?
I don't, yeah, you should be able to print out the reviews. Yeah. Those are all still open.
just download them.
Download them, yeah. Because I think I downloaded all my reviews and transferred them to Word. So just in case I'm missing one,
Oh, yeah.
I might just make sure I can still print it out.
Yep, and then the 110 will close, so you guys make sure you have your reviews, because then, remember I told you in 112, we're gonna have everything in this section plus everything in that section as the final.
Okay.
So that final will probably be like
What is
3 or 4.
iatrogenic injury? Iatrogenic injury?
Are you looking at something specific?
Yep. Chapter 2 quiz, provide a definition for the following words.
Ah.
Iatrogenic injury.
Results, injury resulting from the activity of healthcare professionals.
What is it?
And I think it's
Injury
Iatrogenic.
resulting from the activity of healthcare professionals.
Yeah, it is iatrogenic.
Oh, that's an I.
Yeah,
Okay, that was the thinking of
I know, it kind of looks like an L. And I don't know if I did printed it out wrong on your little review thing.
When does the next section, when do we complete the next section? We started,
The 112
yeah.
will be done the first part of December.
Okay.
Yeah.
So along with everybody else who's taken, pretty much we'll kind of cruise in with them, and then the next section begins in January.
So you had that break the whole time, or are we still meeting class?
Yeah, you guys are off for like a month, a little over a month, I think. Yeah. Yeah, you have a
What day
big,
does
big
the
break.
next section start?
Like 112?
Is it like,
So Friday is the end of 110, so Monday.
Monday we start 112, okay.
Yeah.
And then we just gotta make sure and complete payment and stuff for the next semester by
In spring?
spring.
I don't know. I'll find out for you though. Also, today they're having that FAFSA Fest thing. So if you guys get a chance, you might want to swing by there because they're giving scholarships. And you don't, I mean, you can, I think they ask you a few questions. It's for FAFSA, but even if you're not applying for FAFSA, I think they just have you fill out a few things and they put you in for the drawing. And then you can win other prizes by voting.
They have to do it.
Well, it says free popcorn, so popcorn.
That's where I smell the popcorn. You think there's more in the popcorn?
On the calendar, it says first draw for non-payment in January.
The Henderson?
No, Sun's room.
Oh, January 4th?
Yeah, so,
Okay.
yeah, where the cafeteria is across, like, there's a room over there.
Sunroom on the windows.
Wow, we finished that quick.
Did
You guys
say
are
that
good?
We would still have access to our tests from this section when we're in section 1?
No, you won't. Once this section closes, you won't have access to any of the stuff in 110, okay?
So we need to make sure we print out and keep everything for the next.
That you need,
Yeah.
yeah. I mean, like Appleton and all that will still
We'll still
be
be,
there, but
right.
yeah,
but
all your tests.
all the reviews and stuff like that, just kind of catalog them and notebook them so we
Yeah.
have them.
Yeah, because we won't have them in the next section.
How long is the final for the entire class?
How long does it take, or how many questions?
Questions are you
Usually 400. Yeah, it's not bad.
Oh, that's not bad.
Well, when you consider how many chapters, considering 110 is 200 questions, could do like 800.
No.
That's
I'm
too
okay with
much. I feel like that's too much.
I feel like it's 2 days.
Yeah.
Board's test is 800?
Huh?
You say the board's test
No.
is? Oh.
No, that one's like, it's either 200 or 250. I think it's 200 questions.
for the certification?
Yeah. Yeah, and you're given like 4 hours to take it. You can miss quite a bit, actually. They throw out 25 questions that are in there, and of course you don't know which 25 they are, but they throw out 25. I think you have to have, out of the 175, you have to have at least like 120 correct.
That's not too bad.
No, it's not bad.
That's pretty reasonable.
It is.
So, and where did you say we could get like information on rough tests, kind of like almost like simulation tests?
So AST offers like an app that you can purchase. I need to print you guys out like kind of a rough idea of what they're going to be looking for.
Yeah.
And then also they sent me 2 free tests. And what I like to do, because they always tell me to give them to a student, but what I'd rather do is just as a group, maybe you guys can take it together. Just kind of get an idea. There's 2 of them, so we can do it twice. Yeah. Yeah. Yep.
Cool.
You guys haven't gotten your AST membership cards or anything yet? No? Well, you should soon. I mean, if you went and got on AST or called, I'm sure they have your information. They could give you your member number, but you can just wait until you get your card. Should be getting them soon. Watch you guys go home and check the mail, and they'll be in there today. In the magazine this month, they sent information for recertifying. And if you guys don't get that, I'll print out copies of mine and give it to you.
So are you currently certified still?
Yeah, you have to be a certified surgical tech to teach for an accredited program. Yeah. All right, you guys are good to go. If you think of any questions over the weekend, let me know. I'll be here. If you guys want to stop by Friday, Saturday, or Sunday, the 4 students from Alamogordo will be here.
You said that's starting at 8:30 on Saturday.
Yeah. Yeah.
And for Friday too, it's 8:30?
Friday they're going to be here at 8 because I need to take them to get IDs and stuff. Sure.
Dale recruited some people already.
Have a good weekend.
You too.
Dale recruited people.
Yeah.
All right, so